Bismillahirrahmanirrahim. Today I am going to discuss parturition, increase uterine excitability near term. Parturition means birth of the baby. Towards the end of pregnancy, the uterus becomes excitable and finally develops such strong rhythmical contraction that the baby is expelled. Two major effects lead to contraction which are responsible for parturition. Hormonal changes that cause increased excitability of the uterine muscle, and progressive mechanical changes, which is due to the increase in the size of the baby, which cause stretching of the uterus muscles and make it excitable. Increased ratio of estrogen to progesterone. Progesterone inhibits uterine contractility during pregnancy, helping to prevent expulsion of the fetus. Estrogen have a definite tendency to increase the degree of uterine contractility. They both oppose the action of each other. One increase the contractility and the other decrease the contractility of the uterine muscles. Estrogen to progesterone ratio increase sufficiently towards the end of pregnancy to be at least partly responsible for the increased contractility of the uterus. Here in this graph, up to the 24th week of pregnancy, the secretion of estrogen is overwhelming than the estrogen, and after 24 week of pregnancy, then the estrogen secretion become increased, the ratio change and it become increased, and near term the ratio become quite high, which can cause contraction or excitability of the uterine muscles. So this ratio, with the passage of time of pregnancy, the ratio of estrogen and progesterone become change. The one is concentration of progesterone decreases and the concentration of estrogen become increase, and this is one cause, hormonal cause of contraction of the uterus. Human chorionic gonadotropin hormone. Here another hormone are human chorionic gonadotropin hormone. This hormone is produced by the placenta during pregnancy. Normally it is not produced in the female body, it is produced in pregnancy by the placenta. The function of this hormone is twofold. At one hand, it causes thickness of the uterus for the support of the baby, and on the other hand, it causes prevention of the menstrual or rhythmical cycle of the female or female rhythm. HCG level rise after conception and continue to rise until about 10 weeks in pregnancy. As the pregnancy takes place, concentration of this hormone rises up to 10th week of pregnancy. In this graph, this is a time duration of pregnancy and it is concentration of the hormone. Here up to week 10, the concentration of this hormone rises, and HCG can be found in a person's blood around 11 days after conception. It takes slightly longer for HCG to register on urine test. So the time taken by this hormone to appear in the urine is longer than it appears in the blood. So the urine test is a bit later than the test performed on the blood for pregnancy. HCG increase quickly, almost double every 3 days. After passing 3 days, the concentration of HCG become double for the first 8 to 10 week of pregnancy. 10th week of pregnancy. Healthcare providers look at how quickly a person's HCG level rise in an early pregnancy to determine pregnancy. This is the increase in the level of HCG up to 10th week of pregnancy, and after 10th week then there is decline in the concentration of this hormone. Effect of oxytocin on the uterus. Oxytocin is a hormone secreted by the neurohypophysis that specially cause uterine contraction. There are 4 reasons that oxytocin increase the contractility of the uterus near term. 4 factors are responsible due to which oxytocin causes contraction of the uterus. First effect is the uterine muscle increase its oxytocin receptor and therefore increases its responsiveness to a given dose of oxytocin during the lateral few months of pregnancy. On the surface of the uterus, the receptor for oxytocin increases, and due to this increase in the last few months of pregnancy, the response of uterus to oxytocin increases. The rate of oxytocin secretion by the neurohypophysis is considerably increased at the time of labor. When the labor starts, secretion of oxytocin by the pituitary gland is remarkable increase in the oxytocin secretion. And the third reason is that in hypophysectomized animal can still deliver their young at the time labor is prolonged. They are young at term, but the labor is prolonged, and hypothalamic and hypophyseal connection, when they are disconnected in animals, still birth occur, but the delivery time is prolonged or the labor time is prolonged. So it shows that oxytocin play a role in parturition or birth of the baby and reduce the time of delivery. Irritation of stretching of the uterine cervix as occurred during labor can cause a neurogenic reflexes through paraventricular and supraoptic nuclei of the hypothalamus that cause the posterior pituitary gland, the neurohypophysis, to increase its secretion of oxytocin. When at the time of delivery, when there is stretching of the uterine muscle and the cervix, it also cause release of oxytocin by the paraventricular and supraoptic nucleus of the hypothalamus. So these are the 4 reasons due to which oxytocin cause or play its role in labor or parturition. Effect of fetal hormone on the uterus. The fetus pituitary gland secrete increased quantity of oxytocin, which might play a role in exciting the uterus. The fetus also have pituitary gland. This gland also start excessive production of oxytocin at the time of when the process of birth is started, and it causes excitation of the uterus or play its role in the excitation of uterus. Also, the fetus adrenal gland secrete large quantity of cortisol and other possible uterine stimuli. Cortisol also cause contraction of the uterus. In addition, the fetal membrane release prostaglandin in high concentration at the time of labor. Prostaglandin, also called contraction of the smooth muscle. These two can increase the intensity of uterine contraction. Stretching of the uterine musculature. Simply stretching smooth muscle organs usually increase their contractility. Intermittent stretch as occur repeatedly in the uterus because of fetal movement can also elicit smooth muscle contraction. The baby movements in the womb of the mother cause stretching of the uterine muscle and which leads to contraction. Twins are born on average 19 days earlier than a single child, which emphasizes the effect of mechanical stretch in eliciting uterine contraction. Two babies stretch the uterus more. That's why in case of twin, the labor or parturition occur 19 days earlier than the single pregnancy. Stretching or irritation of the cervix. Stretching or irritating the uterine cervix is particularly important in eliciting uterine contraction. For instance, the gynecologists frequently induce labor by rupturing the membrane so that the head of the baby stretches the cervix more forcefully than usual or irritate it in other way. As the stretching of the uterus causes contraction of the uterine wall, obstetricians usually rupture the fetal membrane, cause stretching of the cervix forcefully, or irritate it in other way. Onset of labor. During most of the month of pregnancy, the uterus undergo periodic episode of weak and slow rhythmical contraction called Braxton Hicks contraction. These contractions become progressively stronger towards the end of pregnancy. Then they change suddenly within hours to become exceptionally strong contractions that start stretching the cervix and later force the baby through the birth canal, thereby causing parturition. So these Braxton Hicks contraction increase at the end of pregnancy, and it causes strong contraction of the uterus, causing stretching of the cervix and push the baby through the birth canal, and therefore cause parturition. This process is called labor. Strong contraction that result in final parturition are called labor contraction. The last ditch or the last forceful contraction which cause birth of the baby are called labor contraction. The positive feedback theory suggests that the stretching of the cervix by the fetus head finally become greater enough to elicit a strong reflex increase in contractility of the uterine body. When there is stretch in the cervix, it sends impulses to the uterus and cause forceful contraction in the uterine body or the body of the uterus, which leads to parturition. This pushes the baby forward, which stretch the cervix more and initially more positive feedback to the uterine. When the contraction in the body occur and it push the baby down in the cervix and cause more stretching of the cervix, so more impulses are sent to the uterus body and there is further increase in contraction of the uterus. Thus the process repeat until the baby is expelled. Abdominal muscle contraction during labor. Once uterine contraction becomes strong during labor, pain signal originate both from the uterus itself and from the birth canal. Stretching of the uterus and cervix cause pain. Originate pain both from the birth canal and from the stretched uterus. These signals elicit neurogenic reflex in the spinal cord to the abdominal muscle, causing intense contraction of these muscles. When there is a stretching of the cervix and birth canal, pain is elicited and these signals are taken by the sensory nerve to the abdominal muscle and they also contract forcefully. The abdominal contraction added greatly to the force that cause expulsion of the baby. Mechanism of parturition. The uterine contraction during labor began mainly at the top of the uterine fundus. The contraction occurred at the top of the uterus or uterine fundus and spread downward over the body of the uterus. Also, the intensity of contraction is great in the top and body of the uterus but weak in the lower segment of the uterus adjacent to the cervix. The contraction here are strong in the top and in the body and they are become weaker when they arrive at the level of cervix. Therefore, each uterine contraction tends to force the baby downward towards the cervix. By this mechanism, the cervix is dilated gradually and gradually the head is pushed down and in this way the cervix is dilated. In the early part of labor, the contraction might occur only once every 30 minutes. When the labor started, these pain usually occur, or the contraction usually occur in every 10-30 minutes. As labor progresses, the contraction finally appear as often as once every 2-3 minutes. The duration of contraction then become shorter in the final stages of delivery, and the intensity of contraction increase greatly with only a short period of relaxation between contractions. So when the time is reduced, the relaxation time is also reduced and force of contraction is increased. The combined contraction of the uterine and abdominal muscle cause a downward force on the fetus of about 20 pounds during each strong contraction. When both the abdominal and uterine force are gathered, they join together. They put about 25 pound pressure on the uterus. It is fortunate that the contraction of labor occur intermittently with gaps or blood flow through the placenta and would cause death of the fetus if the contraction were continuous. Blood vessels. Due to contraction, the blood vessels of the placenta are compressed and supply to the baby. Oxygen and nutrient supply to the baby is obstructed. So prolonged contraction of the uterus can cause death of the baby. These contractions in the uterus occur intermittently and allow the blood flow in the placenta to provide oxygen and nutrient to the baby. Indeed, overuse of various uterine stimulants such as oxytocin can cause uterine spasm rather than rhythmical contraction and can lead to death of the fetus. Sometimes some practitioners use oxytocin for the delivery. So it is very dangerous. It has proper protocol. Oxytocin induction of labor by oxytocin has a proper protocol, so that may be followed, and large dose of oxytocin must be prevented because it causes spasm of the uterus rather than rhythmical contraction. Cephalic and breech presentation. In about 95% of birth, the head is the first part of the body to be expelled, and in most of the remaining instances the buttocks are presented parts. When the head is engaged, it is called cephalic presentation, and when buttocks are presented to the cervix, it is called breech presentation. The head acts as wedge to open structure of the birth canal as the fetus is forced downward. First stage of labor. The first major obstruction to expulsion of the fetus is the uterine cervix. The cervix prevents expulsion of the baby from the uterus. Towards the end of pregnancy, the cervix becomes soft, which allows it to stretch when labor contraction begin in the uterus. The so-called first stage of labor is period of progressive cervical dilation lasting until the cervical opening is as large as the head of the fetus. This stage usually lasts for 8 to 24 hours in the first pregnancy, but often only a few minutes after many pregnancies. Second stage of labor. Once the cervix has dilated fully, the fetal membrane usually ruptures and the amniotic fluid is lost suddenly through the vagina. Then the fetus head moves rapidly into the birth canal, and with additional force from the above, it continues to wedge its way through the canal until delivery is effected. This is called the second stage of labor, and it may last from as little as 1 minute after many pregnancy to 30 minutes or more in the first pregnancy. Separation and delivery of placenta. For 10 to 45 minutes after birth of the baby, the uterus continues to contract to a smaller and smaller size, which cause sharing effect between the wall of the uterus and the placenta. The separation the placenta from its implantation site. Separation of placenta open the placenta sinuses cause bleeding. The amount of the bleeding is limited to an average of 350 milliliters by the following mechanism. The smooth muscle fiber of the uterine muscle are arranged in figure of 8 around the blood vessel as the vessel passes through the uterine wall. Therefore, contraction of the uterus after delivery of the baby constrict the vessel that had previously supplied blood to the placenta. In addition, it is believed that vasoconstrictor prostaglandin form at the placenta separation site cause additional blood vessel spasm. So two mechanisms are involved. One is the uterine muscle are arranged in figure of 8, and when they contract they press these vessels which supply the placenta and stop bleeding. In other that the prostaglandins are produced by the detached area which cause further contraction of the vessel which were attached with the placenta. Labor pain. With each uterine contraction, the mother experiences considerable pain. The cramping pain in early labor is probably caused mainly by hypoxia of the uterine muscle resulting from compression of the blood vessel in the uterus. This pain is not felt when the visceral sensory hypogastric nerve which carry the visceral sensory fiber leading from the uterus have been sectioned. However, during the second stage of labor, when the fetus is being expelled through the birth canal, much more severe pain is caused by the cervical stretching, peripheral stretching, perineal stretching, and stretching or tearing of the structure in the vaginal canal itself. Involution of the uterus. During the first 4 to 5 weeks after parturition, the uterus involutes, its weights become less than half its immediate postpartum weight within 1 week and in 4 weeks if the mother lactates. The uterus may become as small as it was before pregnancy. So breastfeeding actually helps involution of the uterus. A feeding mother uterus involutes earlier. This effect of lactation results from the suppression of pituitary gonadotropin and ovarian hormone secretion during the first few months of lactation. Breastfeeding also helps in family planning or prevent other pregnancy because there is when the mother feeds the baby there is no ovulation at least up to in the first few months. During early involution of the uterus, the placental site on the endometrial surface autolyzes, causing a vaginal discharge known as lochia, which is first bloody and then serous in nature, continuing for a total of about 10 days. After birth of the baby, this lochia continues for about 10 days.